very much privileged today to receive the CS for Health, Honorable Nahumicha, who is on an inspection tour of our health facilities. And I want to really thank you so much that you are starting the year with us. I also take this opportunity to wish you a happy new year and His Excellency. It is important that we are starting this year as a working year, a year to deliver. So I just want to welcome you. We are working very closely on primary health. We have already given out all the kits that we received to our CHPs. And we are now looking forward to making sure that at least in every ward, we have got some health facility that is properly equipped, both with medicine and even human resource, so that we are able to promote that primary health care provision, which we are working in partnership with the national government. I also just want to urge you, Waziri, that we still have got quite a bit of challenges in the health sector, especially at level 4 and even what we are calling level 5, both in terms of human resource and sometimes the equipment and even the facilities. These are areas that I believe we should still continue to collaborate. I'm one person who believes that our customer is one. There is no customer for national government and a customer for county government. So if we collaborate and our customer is happy, we all then will be delivering. So I really want to urge you in your efforts that you are doing, and assure you that as Busia County and as a member of the Governor's Council, that areas that may be grey in terms of what may hinder quick service delivery and the vision that we are sharing, we should not allow that to crowd our service delivery to the people. Otherwise, to me, health is a major issue, and for Busia residents, I want to assure you that we are going to work round the clock to turn around things, the situation, the pathetic situation that we have been in, and this is the time, because there is no time to delay. If you delay, we are losing people, people die, so we can't afford any kind of luxury around that area. So nashukuru Waziri sana that the first working day of this new year, Busia is part of your calendar, and I want to tell you that we are going to cooperate in the best manner possible. Asante sana na karibu.
Thank you very much, Your Excellency, Governor Toma of this beautiful county of Busia, and thank you for hosting me this morning. I'm here on our working tour, doing the UHC spot check, which we have been going around the country. And now that I come from this sides of Western, I saw since I was home, before I head back to the city, I do a tour of the health facilities within the Western region. On 2nd, I was in Lugulu and the Webuye areas, and today I'm here in Busia. Governor, I want to thank you, as you have correctly affirmed, and I'm happy that you have distributed the kits and the gadgets that we gave to your community health promoters. So what we are here to do is now to see what is the next level of service from the community level, which is the CHPs, which we have handled very well, worked together very well, the national government and county governments. Now we go to the next level of service, which is the dispensary and health centers. So my visit is going to focus around the low-level facilities. And most of the people, most Kenyans know, the things that they need to find in a health facility is to find a health worker and to find medical supplies. That is what we are going to focus on. We want to move around and see. And where there are gaps that we identify, Governor, we will work together with you and with other governors so that we are able to fill the gaps of human resources at the dispensary level, and we are able to fill the gaps of medical supplies at the dispensary and the health centers. But having said that, Governor, and since I'm in Busia, I want to assure the people of Busia County that we work very well with the governor. And as a ministry, we have prepared ourselves to roll out the Social Health Authority, and we have a slight setback from the court case. But I want to assure not just the people of Busia, but Kenyans at large, that immediately this court case is out of my way. I only need 2 weeks, and we'll have rolled out and ensure that all those Kenyans who are paying a minimum of 500 shillings for NHIF will now come to 300 shillings, and ensure that each and every Kenyan is enrolled into the Social Health Authority. That is my agenda. For those who have had questions on Edu Afia, I also want to assure you that all students are going to be covered under their households, because it does not make sense to cover a student who comes from a household and the rest of the household is not covered. Previously, we have spent about 4.6 billion on Edu Afia, but now that 4.6 billion, we are going to ensure that we put it into a basket to cover the whole household where that student comes from. So I'm very happy. From here, Your Excellency, I'm going to visit Nangina Mission Hospital. As you are aware, we want to work in a primary care network. And a primary care network has both public facilities, private facilities, and faith-based facilities. So we have to see how is it then that we start working together with the mission hospitals to ensure that once they are aligned into the primary care network, then they are able to provide services. Later in the afternoon, I'll be in Kakamega, but I want to appreciate you for your hospitality and for committing that we continue working together. Regarding your referral hospital, we have already committed. When the president was here, he committed that we shall send specialists, and I want to confirm that this January, the specialists shall be reporting. Equally, on the equipment that you requested, we are working on a mechanism to get equipment, not just for Busia, but for the whole country. Once we have finalized that, the equipment will be delivered to you. So thank you very much, Governor. Asante sana. Thank you. Thank you.
Thank you. Thank you. And Happy New Year.
Happy New Year. Thank you. Thank you.
Asante.
Asante sana.
Karibu kidogo.
Good.